Presentation is on the tumors of ear. Okay. So first, I will briefly describe what exactly the mean by the tumor of ear, and then we will go with our slides. We have 3D images, 3D videos, which you can observe like in a very deep way. Okay. So let's start. First of all, the tumors of the ear. Okay, it is a rare. First of all, tumors of the ear is a rare. Okay. As compared to the other cancers like the cancer of the lung, cancer of the brain and others, about the ear, there is a very less cases, but these cases are, you can say, more potent, means they need more, you can say, the attention as compared to the other cancer. They are rare, but they are a severe form of cancer. Now, we have from our today's class, principal ma'am class, we have basic clarity about the cancer. We understood that it is not necessary that all the tumors is a cancerous form. Okay, basically if you want the exact meaning of the tumor, the exact meaning of the tumor is it is basically a uncontrolled cell mass, uncontrolled grown cell mass, that is called as a tumor. But if those uncontrolled cell mass tumor is showing the spreadiness, means they can spread from one place to the next place, means they extend from their primary site to the secondary site, they are considered as a cancerous tumor. That are considered as a cancer form of tumor. Okay, fine. And those tumors which are, you can say, inside only one place, they have the only one and another location, they are called as a non-cancerous tumor, also called as the benign tumor. Fine, no problem. So this is a two classification. Now, go with the one quotation, and the quotation is a person whose heart is open, means they know about their own, you can say, the own understanding, their own mentality, they know about their own thinking. They don't need the other books. They don't need the other books, and they are the one who is a good listener. So I hope you will listen my words. Fine. Now let's move to the first slide. So this is our lecture outline, a lecture overview. First, we will go with the basic anatomy and physiology of the ear. Okay, a basic with the help of 3D images. Then we will go with understanding the introduction of the cancer. Then we will understand about the ear tumor. So basically, we know that anatomically ear is divided into the three parts. The first one is called as the external ear. Second one is called as the middle ear. Third one is called as the inner ear. Okay. So based on their locations, the tumors are classified. Fine. So here is your ear. Our ears look like this. Okay. And what do you know? Like, what is the function of ear? A primary function of the ear? Hearing and which is the primary function? Hearing or balancing? What do you think? Balancing. Or you are agreeing with Navya's answer? On what if you are agree? Yes? Exactly. The primary function of our ear is a balancing. Then hearing comes. Okay? Because you know, let me ask you one question. If I ask to you, what do you need in your life? Or stability? Or first you want to hear other people's sound, or you need a stability in your life? You want the stability first? Exactly. So basically, our muscle is the stability. We are sitting on this planet against the gravity. How is possible? It's possible because inside our inner ear, there are the fluids. Okay, when you know these fluids are moving, and that will give the signals to the brain. Okay, and brain will activate certain anti-gravity muscle, and thereby we stand straight in this round planet basically. Okay, we are moving in this round planet. How? Just because there's a proper coordination between our body muscles, basically between our body and our brain, our body and our mind. Fine. So that's our primary function. Now, so let's go with some 3D diagrams, which I am very excited to, like, first time I am using it. Okay, so let's go. Okay, so this is our body. Okay, this is our body, basically this much body area. Okay, and as you are seeing, if I am rotating it, see, This is the placement of our body. And now this is your ear location. You see, this is your ear location. Why I am displaying this diagram? Just because when ear tumors arises or ear cancer arises, it can also disturb the, you can say, the adjacent anatomical structure. What are the adjacent anatomical structure? First of all, your internal jugular vein. Okay, internal jugular vein. There are arteries which are going to supply the brain. Okay, so if there will be a tumor in the ear, it disrupts all those pathways. And apart from that, the one of the major organ, okay, that is called as the TMJ junctions, basically the temporomandibular junction. If I am moving my jaw, it is due to my temporomandibular joint or temporomandibular junctions. So when the cancer start in the ear, and if that type of cancer are malignant type, that can also disrupt this TMJ function. Okay, so remember that whenever cancer appears in the ear, it can also disturb the adjacent anatomical structure, basically the cervical limb, okay, the internal jugular vein, carotid artery, okay, and the temporomandibular joint. So these are the certain anatomical structure. Fine. So this is how our ear is placed. Fine. We have the two ear, and we are simping. I am just highlighting these are the lymph node and the vasculature, the arterial blood supply. Why I am like displaying this diagram? The another reason is that cancer is spread through two things. Already Principal Ma'am described. The one is called as through the vasculature, through the blood supply, and another one, you can say the potent spreader is the lymph node, through the lymph. Okay, so these are the green structure are the lymph, and the red one is the blood structure. Fine, no problem. Now let's move with the ear 3D diagram. Okay. So this is our ear, basically a cut section of the ear. This is ear. And we've seen in previous diagram that basically ear is located in our temporal region. Okay, temporal region, ear is located. The external ear is only present, which we are seeing. This is the external ear, which we are observing. See this. This is your external ear. But apart from the external ear, the rest of the part of the ear is located inside the temporal cavity. Okay, inside your brain region, basically a part of brain region. So this is a cut section. As you are seeing this area, as I am seeing displaying this area, this is called as the external ear. Fine. And the one part, this below part is also called as the helix part. Okay, helix part. And the overall all the part is called as the pinna of the ear. Fine. No problem. Now, so cancer can appear in this area also. Mostly, if I have to show, then here. Okay, here certain type of cancer which we are going to discuss now called as the squamous cell carcinoma, SCC. Okay, that can appear on the upper helix surface. Fine. This is called as the pinna, or also called as the external ear. Now then we have, as you are seeing this cut section, in between we have what is called as external acoustic meter, also called as the external auditory canal. Okay, then we have the basically something called as the tympanic membrane. Are you seeing this tympanic membrane, the third number? Is it visual to you? This 3 number. This is called as the tympanic membrane. Then you have the special arrangement of ear bones called as the ossicle. Okay, can you name them? Incus, steps, malus, incum, and step. It's okay, the smallest one. Fine. So these are the arrangement. I say now you take this round part, a circular part, for a circular canal, or as the cochlea. So this is the overview of our ear. Fine. No problem. Now, okay. So we seeing basically this part. We discussed about this ear anatomy structure, that ear have the external ear, auditory canal. There is something called tympanic membrane, middle ear, then we have inner ear. And as I said to you, that there are certain parts. I mentioned you about the internal jugular vein. I mentioned you about the internal carotid artery. And also there is this here, the middle cranial fossa. Okay, this is basically present in your temporal region. So whenever cancer appears, specifically in the inner ear, if the cancer arises, it can disturb all these adjacent pathway. It can disturb all the adjacent pathway. Fine, no problem. And we discussed about that we need balancing first. A primary function of ear is the balancing, so that is done through the vestibulocochlear nerve. There is a pathway called as the auditory pathway, and that goes to our higher system. Fine. And in the higher system, there are certain organs which is present, which is specifically concerned with regulating your sound. Okay, regulating your sound. So basically, the audio wave, they are changed into the nerve impulse. Okay, they are changed into the nerve impulse, and there are areas which can recognize those impulses and make you understand about the person's sound. Okay, make you understand about the person's sound, what they are speaking now. So already we know, we don't need to discuss more about the oncology. What is oncology? Is cancer spread? Now this is the basic for us. We know that cancer is spread. We know that oncology is one branch of medical science. It still means detecting the cancer, diagnosis of cancer, and the cancer treatment. We already know. Fine. We also know that in the molecular level, there are certain genes which are basically talking between themselves. Okay, they are talking in between. And this talking necessitates the smooth business between our cells or our cell. Okay, if one cell may talk with the another cell, then our business is going, basically your cell business is going smoothly. But if there is an interruption in this communication, that can lead to the you can say the cancer formation. Are you getting my point? Not. This is basically, see, if I am here as a speaker and you are as an audience, if I am speaking something, and if you are able to understand it, it means we have one smooth business. I feel happy, you also feel appreciated, okay? But if I am speaking something, you are not understanding, or if you are understanding, I am not understanding, then it can disrupt our communication, fine? So if there is a disruption, then there is a higher chance to develop a cancer, fine? So in the case of development of the cancer, there is a mutation of these genes. Okay, any of the genes, we have the 20 to 25,000 genes, but there may be any gene can mutate. Fine, no problem. Now we already know that we have a cell brain that is called as the nucleus, where our genetic material is beautifully placed, protected. We have first we can go with we have the chromosome. Then chromosome is located in the DNA. And in the DNA, there is something called gene is present. So we have about this much gene is present. Okay, no problem. Now, I shall zoom out it. Okay. Now, we already aware about this term. I think we all know about this term. Okay. We know that something called as the metastasis. Metastasis is basically a property of cancer to spread. Fine. We have the malignancy, a cancer which is already spread. Then we have the hyperplasia, as you are seeing. Increase in the cell number is considered as the hyperplasia. Then we have the hypertrophy condition, where the cell of the cell's growth size increases basically. And we have the metaplasia, we have the neoplasia, new tumor formation. We have the aplasia, there's a normal cell, okay? No cancer growth. Now, we also seen, and as a principal ma'am emphasized, that we have something called the tumor suppressor gene. You see this diagram. We have the tumor suppressor gene, fine. And this tumor suppressor gene, whenever cancer appears, this tumor suppressor gene is going to in their inactive state, okay? They are going into their inactive state, means they are no longer functional in our body. So, and the primary function of this tumor suppressor gene is that it, you can say, inhibit the growth of abnormal cells. It can inhibit the growth of abnormal cells. When one cell deviates from their natural functions, okay, they are going against their natural function, then these tumor suppressor cells, they direct those cells, you can go and die. And that condition is called as the apoptosis. I'm pronouncing correct? Apoptosis, okay? And this apoptosis phenomenon is absent in the case of cancer, okay? So this is one of the characteristics, one of the difference basically between the cancer and the normal cell is that the phenomenon of programmed cell death is present in the case of normal cell, whereas whenever cancer appears, it can take away this phenomenon. Fine. We have the another gene called as the that regulate basically the repair or the mutant gene reappearance. Okay, means when our one gene mutate, there are certain you can say enzyme basically that can that enzyme can prepare our genes. Okay, that enzyme prepare our gene. Fine. So whenever a cancer appear, that also suppress our this repair gene. Fine. Apart from that, we have the proto-oncogene, which is basically our natural cells, but cancer appear and they change this proto-oncogene into the oncogene. Fine. Apart from that, cancer not only inhibit this phenomenon, we already have discussion about the structure and function relations. We know that we got shape of eye oval just because of their functionality. If it is a rectangular, it cannot absorb this 3D world. So we discussed the basic pathophysiology of cancer. The basic pathophysiology of cancer goes with basically disturbing some of our cells. Basically you remember just two cells. The one is called as the tumor suppressor gene or tumor suppressor cell. Another one is called as the proto-oncogene. Basically our cancer change into the oncogenes, the cancer causing cell. Okay, and one more you just remember about the DNA repair genes or DNA repair cells. Okay, so these are basically three cells which lost their function whenever cancer appear. Okay, no problem. About this genetic mutation, activation of oncogene, and the loss of tumor suppressor gene, immune evasion, and loss of signaling pathways. So these are certain phenomena. Whenever cancer appear, this phenomenon will also appear. Fine, no problem. Now let's go with our cancer. So this is what we are going to discuss. That is called as the ear tumor. As I said you that ear tumor is a rare. Okay, ear tumor is a rare. And also please make silence. Hello. Try it. Okay. So basically the ear tumors are rare and severe. Okay, they are rare. Also they are severe. Fine. So how you define the ear tumor? Anyone have answer? How you are going to define what is ear tumor in the simple language? Yeah. Abnormal growth of? For that.
Yes, sir.
You can take the mic if you want. No one does need, no problem. No more on it, yes. Okay. So basically the ear tumor is when the ear cells, they are abnormally grown. Okay. If they are abnormally grown, we consider those grown cells as a tumor cell. Fine. But remember, this tumor is need not be only the cancerous. It can be non-cancerous. And most of the ear cancer are not. Most of the ear tumors are basically a non-cancerous form. That's why we have the heading ear tumor, not a ear cancer. But yeah, certain forms like something called as the ceruminous. We have a ceruminous gland. Okay, which second the selenium wax, basically ear wax. So if cancer appear on that gland, that are a malignant type. So we can say that tumor as a cancerous tumor. Okay, cancer tumor. So this is about the ear tumor. I hope you clear with this slide. Now let's move. So as I said, that ear is anatomically divided into the three parts. The same tumor classification is also divided into the three types. The first tumor which appear in the external ear, as we seen, that is called as the external ear tumor. If the tumor appear in the middle ear, we are referred those tumor as the middle ear tumor. And if the tumor arises in the inner portion of the ear, that is called as the inner tumor. Now, let me ask you one question. What do you think? Which type of tumor is more dangerous? Inner tumor. Exactly. The inner ear tumor is the most severe and most dangerous condition. If we study the comparison view, then the inner ear tumor are the most severe and most dangerous form. Fine, no problem. Now, apart from that, we know that ear have another classification based on their proliferation. Okay, based on their proliferations, ear have another kind of classification, and we already know. If it will proliferate, means malignant cancer, isn't it? If it proliferate and spread to the other organs, like they detach from their primary location and goes to the secondary locations, they are called as the malignant type, malignant tumor. Okay, and if tumor is attached within their you can say the proliferative locations where they are start to grow. Fine, they are called as the benign tumor. So basically, they are the non-cancerous tumor. Benign tumors are the non-cancerous tumor, whereas the malignant tumor are considered as a cancerous tumor. Fine, no problem. So this is the two classification. You just remember that one is based on their anatomical location, and another one is based on their proliferation. Okay, based on their proliferative or invasive, means invasion, means they invade the tissue basically. Okay, now the one thing here you have to keep in your mind is that there are classification systems. And most of the time this is offered by WHO or World Health Organization. So in the recently their classification of their head and neck cancer, they classified the ear cancer like they put the external ear tumor in one classification, fine, and middle ear tumors and the inner ear tumors in a one classification. Means if you're talking about the ENT classification of the cancer, then coming to the ear, in the ear there is only two classification. In one there is a external ear tumors present, and another the middle ear tumor and inner ear tumor present. Now I just want to check your intelligence. Why WHO done this type of classification? What do you think? What is the reason behind this classification? Why external ear tumors are separated, and why not these two are separated? Why they are jointly put it in the classification? Why? Exactly. The one of the reason which explain why they put it, just because they are anatomically, you can say adjacent. They both are the adjacent first of all, and second thing is that in the both the tumors, the biopsy is the rare. Okay, you cannot always make the endoscopy in your ear and you just put out some tissues. It's not really possible every time. Okay, so their biopsy as well as their location, okay, is nearby. That's why WHO put both the tumors in the same place. And sometimes what happened in the case of the malignant cancer, it's quite possible that the cancer appear first in the middle ear and they spread to the inner ear. So that's also make the confusion to differentiate between the primary inner tumors and the inner ear tumors. So they are jointly placed. Fine. So here is some key points about the ear tumor. We already know that the ear tumor and the temporal lobe tumor, okay, they are the rare form. Fine. They are the rare form, and also we discussed their biopsy material is limited. No problem. Then we see in that they also lack one thing. The ear tumors lack also one thing, and that is called the staging. Generally, we have the MLM classification based on the lymph node, based on the metastasis property, and based on the tumor. Okay, so we have this classification, but in the case of the ear tumor, they also lack the staging. Okay, you cannot provide this first stage, second stage, third stage. Just because you see that the reason are also there, because staging is not present, just because there are, as I said, that you cannot exactly predict that where cancer is started from where and where it is spread. Okay, so you cannot basically identify the primary location, okay, primary origin of the cancer. So that's why the staging system is not present. Apart from that, we already discussed, no need to read the slide, just understand that just because these two inner ear tumors and the middle ear tumors, they are placed nearby, so WHO put it this time jointly in the classification, and next time the classification is apart. So it also is for us. It is for us in terms of we have to only study the two classification system, that is external ear tumor and inner and middle ear tumors. We study in the one session, okay, in one slide. Fine. Okay, so thank you for having us. Bye. Have a nice day. Yeah.